Great. Thank you very much, Alexi. My name is Laura Turner. I'm the Executive Director for HIPSA, which is the organization that publishes Student Doctor Network. We have a number of resources available to help you on your journey to try and get into a health professional career. And we are doing a series of videos to help you learn about different aspects of the application process. And so today I'm very pleased to be joined by Dr. Ziggy Yoediono, from MedSchoolCoach, who's going to be talking today about extracurricular activities, the activities that you do outside of your academic career to help create a well-rounded application for medical school. So now I'll turn it over to Dr. Yoediono.
Thank you so much. Hold on, I'm going to click on the. Thank you so much, Laura. I really appreciate it. I'm so excited to be with you guys today to talk about extracurriculars, talk about branding. I'll get to all of this later. It's very, very important. Just to give a little bit of background about myself so you have a sense of my education and training. I went to Yale for undergraduate, University of Rochester for medical school. I did my psychiatry residency at the Harvard Longwood program, and then I got an MBA at Duke. And I've been with MedSchoolCoach since 2019, and I'm one of, as Alexi mentioned, I'm one of the associate directors of advising. So I'm going to give you my talk about extracurriculars today. I hope you guys have lots and lots of questions. I think those are the most important part of a webinar, basically, to make sure that we are addressing whatever questions, concerns that you have, basically. So one of the most, as you are looking to apply to medical school, one of the most important things you want to do is position yourself in the best way possible in terms of your candidacy. So by the time that you apply to medical school, you are the strongest candidate possible, right? And one of the most important things that you need to do, as soon as possible, even if you're starting college, like freshman year, as soon as you step on campus, but you have to do it at some point as soon as possible, which interestingly enough, through my experiences with all my clients, they haven't been doing, is you have to brand yourself. Now, we've all heard the term branding, basically. It's a marketing term, basically. And it's, as the name implies, you're talking about what makes you special, basically. What is your added value that, by the time you apply your junior year or your senior year, what is your unique story? What is your unique narrative, basically? It's thing to do, basically, because it's not just, a buzzword or a slogan that you come up with, but it has to be backed up by the experiences that you have, in particular, extracurriculars, academics, things like that, basically. And, this is really important because, as I'm sure you guys know, the med school application process is getting more challenging by the year. And it's not just enough to say that you want to become a physician because everyone in your family is a doctor, or you got a toy stethoscope when you were 3 or something like that. These are very legitimate issues and reasons, but you need more than that these days, basically. And your brand will impact you in 2 ways. If you start early enough, it will help provide guidance on the extracurriculars that you actually choose, which I'll talk about a little bit later. And then later on, as you actually apply to medical school, as you do your MCAS application, DO schools, the Texas schools, this will impact the personal statements that you write, your work activity section, the secondaries, how you present and frame yourself during the interviews. So, of course, this begets the question, wow, what do I even need to do to start branding myself? So one of the first things you need to do is think at a very granular level, going beyond, I just want to help people, about why you are passionate about becoming a physician. And if possible, imagine how you see yourself practicing as one later on. Do you see yourself doing cardiovascular research? Do you see yourself working in an academic setting? Do you see yourself in a rural setting, urban setting? Think about how you imagine the future doctor you practicing, basically. And based on that, at least the approach I utilize with all my clients is that you can brand yourself in one of 5 ways, basically. It doesn't mean you have to have all 5 ways, but you can pick one of these ways to start thinking about how you can brand yourself. The first way is the most obvious way, which is based on interest, right? So, I have so many clients who say, oh, I want to be a pediatrician, I want to be an oncologist, I want to be a psychiatrist. All right, well, you've got part of your brand figured out because you know what specialty that you want to do. So that's the obvious way. Now, to be fair, a lot of med school applicants, and quite frankly, a lot of med school students don't even know what they want to do, even until 3rd year of medical school when they're doing their clinical rotations, basically. So what are the other ways that you can brand yourself? A second way you can brand yourself is based on an approach to medicine that is of interest to you. So I have a lot of clients who are passionate about, for example, preventive medicine, or they are passionate about a public health approach to medicine because they have done, they major in public health, they've done activities related to public health or preventive medicine. So approach to medicine is another way that you can, consider branding yourself. A third way that you can brand yourself is demographics. Right. So now there are some demographics that automatically lend themselves to specialty, right? Such as pediatrics, women's health or something like that. But there are also other ways in terms of demographics. So for instance, I've had clients who are not surprisingly passionate about helping those in need, right? So they have worked in soup kitchens, they've worked at clinics that serve, uninsured populations, they have done experiences related to the demographic they are passionate about. It could be with immigrants, even Spanish-speaking populations or other languages which are of interest to you. So there's definitely a lot of different ways in terms of demographics that you can have an interest, and that's something that you should consider pursuing if that's a passion, if that's of interest to you. A fourth way is it can be based on a specific medical issue. So I briefly had a client who was very passionate about medical technology and medical devices, innovation, and she really did a lot of experiences related to that, helping create medical devices, things like that. So that made logical sense as a way for her to brand herself. And then the fifth way, as I sort of alluded to the beginning, is, if you pick one of the 4, that's fine. And of course, sometimes you can pick more than one of the 4 that I mentioned, basically. I have some, clients who want, it makes completely logical sense, but don't feel like you have to pick all 4, find a way to connect all 4 that I mentioned. That ends up looking unnatural, and it doesn't work, basically. The thing to remember about branding, and this is why I said you really want to start it as soon as possible, is that it takes time to do, ideally. I mean, the ideal approach is, if you are a freshman, if you're just starting off college, that you're already thinking about what your brand is going to be. And why is this important? Well, let's use an example. Let's say, for example, as you're sort of thinking about your brand, you decide like, wow, I'm really passionate about working with children. Well, that's great because that provides clarity on the kinds of extracurriculars that you're going to pursue so that you have a logical narrative by the time you apply your 3rd year, basically. And so if you, for example, say, I'm passionate about working with children, well, that means that, if you do some shadowing or clinical work, in terms of scribing, it's most likely going to be with a pediatrician, right? If you do community service, maybe you're going to do some volunteer work at an elementary school to help underprivileged children, right? And if you do research, that means maybe you're going to do something like ADHD, or maybe, cancer that is more prevalent among children, right? So then there's a common theme that runs throughout all of the extracurriculars that you're doing, basically. And as I mentioned before, it's also going to impact what you write. A big part of the application is the personal statement and talking about why you are passionate about becoming a physician and what makes you uniquely qualified to become a physician. And the theme, quite often, at least when I work with my clients, often, directly correlates with the brand that they come up with. And so I usually have them figure out their brand first, and that automatically becomes their theme. And then they're able to support it with the experiences that they've done before, basically. So that's what I want to say about branding. The second thing I really want to talk about is, as the title of the webinar says, extracurriculars, but hopefully you can see the connection between the two. So in terms of the extracurriculars, I think, I don't know if you're aware, but I don't like to make assumptions. Let's review really quickly, what are the extracurriculars that med schools want to see by the time you apply, right? So they are shadowing, clinical experience, community service, and research. And actually the fifth one I would add is hobbies, basically. So I want to talk a little bit more about each of those in depth and how to optimize it, basically, right? It's not only just doing it, but it's optimizing it. So in terms of shadowing, we recommend that you try to shadow at least 3 different physicians in 3 different fields. This is good because you want to demonstrate that you are taking the time and effort to understand what's out there in the medical field, and to have an appreciation of the fact that, not all specialties are the same, that of course what you do and how you treat are different, but even, sort of the ebbs and flows of the daily life of each of these different specialists is also different. And it's good for you to know that too. I mean, the more that you explore, the better idea you're going to have of what you might want to do later on, basically. So that's very important. The second thing is clinical work. And sometimes people confuse shadowing and clinical work and ask what the difference between the two is. Shadowing, as the name implies, you are literally shadowing a physician, following that physician around, usually just observing how the physician interacts with the patient. With clinical work, that means you are actually interacting directly one-on-one with patients, basically. And we recommend, so let me put it this way. The most common type of clinical work that is done among med school applicants is, volunteering at a hospital, in the form of, greeting patients or working in a certain department and, transporting patients, giving blankets, things like that. And, that is a great experience to have. It's your first time being in the clinical field, and it's really great to have those kind of experiences. That being said, I often recommend that my clients try to do something different than just hospital volunteering. And it's not because hospital volunteering isn't important, but it's because so many applicants do hospital volunteering. And there's only so much that you do. And that means it's harder to differentiate yourself at the end of the day in terms of your responsibilities. So we often recommend doing clinical work such as scribing, EMT, hospice volunteering, clinical research. The reason those kinds of experiences are really good to have is there's a higher level of responsibility that you have, and there is more detailed, intimate patient interaction, basically. And so if you have that, you're able to differentiate yourself from people who might do clinical experience where they're not having that kind of interaction. But let's do worst case scenario. And let's say that you are not able to do scribing, EMT, hospice volunteering, that the only, let's say, in-person experience that you can get is volunteering in the hospital. So, that begets the question, well, how do I differentiate myself? So, to that, I would say, try to look for, as you're doing the hospital volunteering, try to look for opportunities where you can differentiate yourself and see maybe, there's, opportunities where there's, a way to improve the process or the experience that you can then translate into a proposal that maybe you can take the lead on and then differentiate yourself. And I'm not just saying this really happened with a client of mine who told me, okay, he said, we were talking about clinical experience, and he said, okay, so I volunteer in an emergency room, which I was like, all right, that's fine. I wasn't super excited about it because a lot of people do that. I mean, again, it's still a great experience. But then as he was telling me more about his responsibilities, he happened to mention, oh, and by the way, I'm the person who's responsible for training all the volunteers. And I was like, oh, wow, this is exciting. And this led to a brainstorming discussion, which then led to the idea that he would propose the creation of a training manual for all the new volunteers. And he actually worked on it and presented it to the person in charge of volunteering, who I think was excited about it. And then he ended up presenting it to the to the chair of the emergency department. Unfortunately, COVID hit right at that point, so it put the kibosh on that. But I think you can see where this discussion could have led, basically, and how far he was even able to get before COVID, made it a little bit more difficult. So, the takeaway is always try to think outside of the box, see what opportunities are out there, and try to be creative in seeing how you can create new opportunities for yourself. The third type of the third type of extracurricular, as I mentioned, is community service. And I just want to be clear, when I talk about community service, what I mean is, you are giving your time to help those in need, basically. Because sometimes I get asked about activities where someone's volunteering, but it's really they're helping a peer or a demographic that really doesn't need help, basically. And while that's great, I mean, it doesn't mean that you shouldn't do it. It really doesn't count as community service. So it's really about giving your time to help those in need, and not getting anything in return like payment or something like that, because altruism is very, very important to medical schools, and they really want to see this. So whether you're working with Habitat for Humanity, working in a soup kitchen, food bank, those are great ways to get involved, basically. The fourth thing is research. It's nice to have at least 2 years of experience if you can, and ideally have at least a middle author publication, and do poster presentations. That's one of the first things I always ask my clients when they tell me they're doing research. So those are the 4 big things. The 5th thing I want to add is this, hobbies. Hobbies are really important. It's a great way, and to be fair, most hobbies get started before you begin college. And so I would highly encourage you to continue it, if it's something you enjoy throughout college and beyond. It's a great way to differentiate yourself. It's a great way to talk about yourself outside of medicine, basically. And it's just great for the admissions committee to know more about yourself, basically, beyond why you're interested in becoming a physician. And, I've had clients who've had really interesting, unique hobbies. I had a client who was, she liked to sew mittens because she was from Minnesota. And of course, it's very cold out there. And she was actually reluctant about sharing that on her work activity section. And I was like, no, you need to write about it. Talk about, what colors you like to knit, what you do with those mittens, why you started it. And she did all of that stuff. And it made a good impression. She ended up getting to a lot of medical schools. I'm not saying mittens was the only reason she got it. She had a lot of other positive qualities too. But she ended up going to Stanford. So hopefully the mitten help make her memorable, basically. So the last, equally important in terms of the experience is not only what you're doing, which I sort of went over in terms of the 4 or 5 things you need to do, but how you do it, basically, right? So to that end, I wanted to end my talk by discussing the qualitative metrics that med schools really care about. When they're evaluating your application, because if you understand that, then you'll really know you'll really understand how to optimize any experience that you're doing, basically. So the first qualitative metric is commitment. Ideally, for whatever experience you're dedicating yourself to, you want, you're doing it for at least 2 to 3 years if possible, right? They don't want to see somebody who's hopping around every few months from one experience to another experience. You're just not going to gain much from that. And that doesn't look good to the med school and, to the people reading your application later on. So commitment is really important. It doesn't mean that you shouldn't cast the net wide at the beginning and explore different things. Of course, if there are things that you don't like right when you're starting off, don't do it, of course. But at some point, you have to sort of commit yourself to a few things and then really go forth with it. The second thing, which commitment enables you to do, the second qualitative metrics, is evolution and growth, right? So whenever you are participating in an experience over an extended period of time, it doesn't look good if you're static, right? You know, you're going to have to write about your experiences later in your work activity section, to an extent in the various essays for the personal statement, secondaries, you'll talk about it during your interviews. You really want to show evolution and growth, right? You want to show that you've evolved in terms of your knowledge, your skills, your approach to thinking, the level of responsibilities that you've had. So, you know, keep track of all of those things. Those are very, very important things to write about later on as you market yourself in your application. Closely related to this is leadership, not surprisingly, right? Leadership is so important to medical schools, given that later on you as future physicians are going to be leaders of various teams, basically, whether it's research, education, clinical experience, you know, you're going to be leading a lot of teams later on. But that means you want to be able to demonstrate leadership before you enter medical school. And so, you know, whenever you can do that, I think that's really important. Now, the stereotypical way, you know, of course, that we think of leadership is when you have an official position in an organization, right? Whether you're a vice president or a president, and that's great. You know, if you're able to sort of show evolution from being secretary to treasurer to VP to president, and you have the goods to back it up, then that's great. But I would add that, you know, you can demonstrate leadership in other ways, basically. You don't have to have an official title to demonstrate leadership. If you are if you're doing an experience and you're able to come up with a proposal, follow through on it, and get results, that's demonstrating leadership, basically. So I just want you to know there's more than one way to think of leadership. The last thing I wanted to talk about in terms of qualitative metrics is results. You know, applicants often forget about results. You know, when you are doing an experience, participating in an experience, you're not only doing it just to do it, you're doing it to accomplish something, basically. And so whenever you can quantify or qualify any results that you've gotten, this is really important. You know, so for example, if you are the fundraising chair for an organization and you raised $5,000 the first year and $8,000 the second year, well, you want to make note of that. And then in addition to that, you want to be able to discuss what you did to get the additional $3,000, right? To go from the $5,000 to $8,000. You know, did you do something with different partnerships? Did you change your marketing approach? You know, social media, whatever it is. You know, when you detail what you did to get that increase, you are then inherently sort of demonstrating another positive quality about yourself, whether it's strategic thinking, the box, you know, whatever it is, basically. And so that is really, really important. So that's the last metric that I really want you to keep in mind as you, as you go through all of your experiences. So I've been talking for quite a bit. I don't have anything else to add at this point. I hope this has provided added value for all of you. And I really welcome and encourage lots and lots and lots of questions.
Great. Well, thank you very much for such a detailed overview. I think that it's really important how you spoke about the importance of narrative and really understanding yourself really well so that you can tell your unique story and how all of your activities will tie into your unique story and your unique qualities that will make you a good physician. I saw there were a number of questions here. So Alexi, do you want me to just go through those questions? And we can, you can enter them in here on the Q&A, which is down at the bottom of the screen. And so let's start with one that I'm sure a lot of folks are running into right now, which is from Videoshri, which is how do they manage the issue of lack of campus-based extracurriculars due to students having to take classes remotely because of COVID?
Yeah, no, that's, everyone is asking about that question, understandably, with the pandemic. You know, when it happened last year, it sort of put the kibosh on all the in-person experiences that were going on. And, sort of related to that, everybody was worried, how are medical schools going to look at this? How are they going to evaluate me? What do I need to do, basically, right? So what I would say is a few things, right? First of all, to alleviate any anxiety amongst all of you who are watching right now, medical schools definitely understand that the pandemic has, hugely impacted your ability to do any experiences. And this is, not just academics, but all of those kinds of extracurriculars I was talking about, right? And understandably, right? We're in the field of safety and health. And so they understand that you want to be safe and healthy, basically, and that you're not going to do this. And quite frankly, it's because a lot of these places also have rules about people participating. Even if you're a caretaker taking, your mom or dad to the clinic, a lot of these clinics don't even let the caretaker in because they really want to be so careful about about interactions among people. So obviously they're not going to have, students who want to just, observe and all that come in. So rest assured that medical schools understand this and that they are evaluating you within the context of the fact that the pandemic is happening, basically, right? And so that begets the question, what do I do, basically, right? How can I, how do I overcome the fact that I can't do the in-person shadowing, in-person clinical experience, in-person research, in-person community service, basically? Well, the obvious answer is virtual. And there are a lot of opportunities out there, basically. I've had clients who were doing all of those types of extracurriculars virtually, basically. They have virtual shadowing. Even MedSchoolCoach has an ability to do such shadowing like that. In terms of community service, there's a lot of, there's a lot of such experiences, clinical experience, there's like crisis text hotline, basically. And I know people who are doing research have been doing it virtually also. So there are a lot of opportunities out there. I think the way that, there's a few ways to approach looking for such opportunities, right? I always think that one of the best ways, of course, is take advantage of your university, right? Your institution, right? They are in the know, they are the best in the know of what's going on. So, you have your pre-health advisor, pre-med advisor, however you may feel about them, take advantage of them. They are a plethora of resources, basically, and they often know even what's happening locally, basically. So that's one thing. The second thing is, there are a lot of student organizations on campus, and they often have developed connections and a repository of resources over the years being an organization. So I would also join them, basically, and see what connections you can make. Connections are so important in life. That's a whole different talk. But it's really, really important. And the more connections you can make through your professors and all that. And that's the other thing. You guys are interacting with your professors, other faculty, staff there. Talk to people who are, if you're looking for a research opportunity, even virtually, in biology, for example, talk to your biology professor, talk to your biology TA. This is the opportunity to network, develop connections, to market yourself, basically. So that's how I would go about it. And of course, there's sort of like secondary research where you sort of do the cold call, cold email, basically, where you look things up yourself and reach out to, whomever that you're interested in. One little caveat I will add, as you're looking for opportunities, let's say, I'm just making this up, maybe there's a virtual lab experience out there that you're really interested, in cardiology. I'm just, making this, I never did research, so I can't talk, but, let's say you have that, right? The average undergrad usually will just send an email and say, hi, Dr. So-and-so, I'm interested in, working in your lab. Do you have any availability, or, something very, short like that. And I always tell my clients, that is not a good way to approach looking for an opportunity, right? It's not only about you asking them what they can do for you. It is an incumbent upon you to market what you can do for them, basically. So, yes, they all understand at the end of the day that you're looking for an opportunity, but it's a lost cause if in that email you don't talk about what qualities and skills that you have that are relevant to the position that you are looking at. So they understand, so they know that you have an understanding of that position and that you've taken the time to really understand. It's not just saying, it's not just like you found this on some job search website or something like that, but that you really are passionate about it and that you've taken the time to understand the responsibilities for this job, the knowledge that's required, the skills that are required, and that you try to talk about it within the context of yourself, basically. So that's a little bit of an aside, but I think it's an important aside because I think that increases your chances much more greatly of getting what you want, hopefully landing a job, basically. And the other thing I just want to add real quickly, as you're looking for I didn't mention this in my talk, but as you're looking for all of these experiences, as you're doing all of these experiences, whether, clinical experience, shadowing, community service, research, the one thing you should keep in the back of your mind as you're doing this is letters of recommendation, right? It takes time to cultivate these relationships, basically. And the best letters are the ones where someone can write in great detail about, why you are the greatest thing since sliced bread, what your responsibilities have been, what your results have been, basically. And so, no matter what experience you're doing, you should do the best that you can, basically. So, it'll come about. But, just keep that in mind as you're doing all these experiences. So later on, when, your junior or senior year comes around and you have to start asking for letters, in January and February, you'll be able to present a good case for why you think they can write a good letter for you. So anyway, that might be more than what you wanted, but hopefully that was helpful.
Yeah, thank you for such a comprehensive answer. I know it's been very challenging for folks with COVID. There's lots of increase in applications as well as a decrease in the availability of the types of typical experiences that people did before the pandemic. Switching over to the next question, someone says that they've heard it's not good to have a specific specialty in mind when they are applying. Right. But is it okay to have an idea, like this person says, they care a lot about women's health and women's health issues. So how would you guide someone when they're talking about what their interests are?
Right. I know it's this concern that you're pigeonholing yourself, basically, right? And so, my first rule, when I talk to clients is you want to be authentic and honest, right? That to me, that's the foundation for everything, basically. And the only reason I mentioned this is not because I think anybody would be dishonest about anything, basically, but it's because, as we talk about, when we use words like strategizing your application and this and that, sometimes the authenticity can get lost in the mix, basically. And I always go back to that quality when we talk about these things. But, to answer your question, there is absolutely nothing wrong with talking about, writing about, expressing a passion for a certain field. I think that's wonderful if you have such a thing in your life, basically. The main thing, as I'll probably sound like a broken record saying this, is that you have to be able to back it up, right? So if you say I'm passionate about women's health, the next thing I'm going to wonder about is what have you done related to women's health, basically, that proves your passion, basically. That's the keyword, proof. It's always about proof at the end of the day. I think as you sort of frame your response, I think inherent in this question is that you don't want to come across as someone who is not going to be open-minded to other possibilities. Like, yes, you may be super passionate about women's health, but who knows, you may go off to medical school, have these other opportunities, do these clinical rotations, and find other opportunities that you're also passionate about. I think the admissions committee understands that you are not cemented to one specialty, even if you express that preference ahead of time. And that I think they hope that you will open your mind to other possibilities as you explore, as you take advantage of their curriculum, their opportunities via clinics, and all these other things. That's the beauty of medical school. That's what you're paying for, is these amazing opportunities to try things that you haven't done before, basically. And who knows, maybe you'll find another opportunity that you can sort of marry along with the current one that you have, basically. So I think the main thing, this is my long-winded way, my takeaway is that you want to be open-minded to all opportunities and not just be like, this is it, I'm not going to consider anything else. That's a bit of a turnoff when people hear that, I think, because in medicine, collaboration is important, teamwork is important. And so that means you have to have an open mind to other perspectives, basically.
Thank you. The next question, I think will be a pretty quick one. It is
Okay.
asking about a unique experience, and would working as a psychiatric tech or behavioral health tech be considered a different experience, something that might be a little more interesting than typical hospital volunteering?
Yeah, I mean, I think uh, on the surface, yes, because quite frankly, that's the first time I've heard of someone doing something like that. So yes, I would say that that is very interesting. I'm biased. I'm a psychiatrist, so of course I love it. But I think equally important to that, and this is true for whatever you end up doing. Of course, don't pick something unique just for the sake of being unique. I think it always goes back to the fundamentals of responsibilities and results, basically. So even if you have the most unique experience, but you don't do anything, it doesn't matter at the end of the day, right? It's a waste of time. Whereas like with the hospital volunteer, like, yes, I sort of didn't shed the best light on it, but I talked about how you could actually make it of added value. So I think for the psych tech, whatever, as long as you optimize that experience, really try to evolve yourself, commit yourself, get results, then I think it's going to be a wonderful thing to write about. And I think what I forgot to mention before, and I should have said this at the very beginning, is ideally you like all the things that you're participating in, right? Life is already hard enough that we have to do things that we don't like. It's called, taking tests in medical school and all that kind of stuff. So, in all seriousness, as you sort of look for these opportunities throughout college, try to like it. It's just, it makes life so much more fun. You're able to stick with it better and deal with the ups and downs when you like something, basically. If you don't like something, you're more likely to give up, quite frankly. So, hopefully you can find things that you really love.
Okay, and then the next question, there's actually two questions that are really similar, so I'm just
Okay.
going to kind of wrap them together.
Okay.
So one, Kim Deering says that they have hundreds of hours of clinical work, shadowing, and volunteering, but minimal research experience. And Mohammed has a similar question about
Yeah.
if someone can one pillar of extracurricular activities compensate for the lack or a shortage on another pillar?
Yeah, no, that's a great question. And I think this is often most commonly related to research, basically, because let's face it, not everybody wants to do research later on in life. I was one of those people. I never did any in undergrad. You couldn't drag me in there if you tried. So I didn't do it, basically. And so, this is what I would say. I feel like, because I went to med school a million years ago. So I think sort of the bar and the standard for what is acceptable is a lot different now than it was when I was back then. Maybe back then I could get away without doing any research. I really don't think that's the case today. I think the expectation is that you will have done some research, basically. Maybe you can do it through a class, a project, or something like that. Not everybody wants to be a researcher. So if that's where you find yourself, I think that's what you need to do at a minimum, basically, just to demonstrate that you've made the effort to understand, because even if you don't like it, it's still important, quite frankly, right? It's the research translates to the clinical work that you do, basically, later on. So I think it is important to have a fundamental, to have experienced it yourself and to demonstrate that you did that, basically. So I think if you do that, you're in pretty good shape. I think research is a little bit easier to explain, or not having done as much research is easier to explain away to an admissions committee later, because they understand that not everybody wants to do research. So, as long as you can talk about the other, if clinical work and education are going to be the areas that you really care about much more, and you can back it up with, having done a lot of that, then I think that's fine. And quite frankly, just to keep in mind as you sort of decide on which extracurriculars you're going to lend more weight to, this of course is going to impact where you apply later, right? There are research-oriented medical schools and there are primary care-oriented medical schools. And so, not that US News and Report is the end-all be-all, but, quite frankly, they sort of were the first movers on this. But they do have a list of, the top research-oriented medical schools and the top primary care-oriented, the UNCs and the University of Washingtons of the world, basically, which actually do research too. So, I think it'll impact where you are more heavily going to apply later on for medical school. If you haven't done much research, by the time you apply, you haven't had publications, you haven't had presentations, then it wouldn't I mean, I'm not saying you shouldn't do it at all, but it doesn't make as much sense to apply to the Harvards, the Hopkins, the Dukes of the world, where people, I've seen the kinds of experiences that people who are passionate about research have done, and it's like mind blowing, basically. I mean, it scares me how accomplished these people are. It makes me feel bad about myself. But anyway, at least I can do therapy with myself. I'm a shrink. So, just keep that in mind later on as you apply.
I think that's a really good point about the bar being raised, because if you look at the latest or the 2020 admissions guide from the AAMC, it's, I believe, 87% of accepted applicants had research as one of their activities, and it's gone up by double digits in the past 15 or 20 years. It has really become sort of a de facto standard that you have to have research now as part of your medical school application.
Exactly.
Moving on to the next question. A year has already passed in the pandemic. How can we combat the consequences of the reduced extracurriculars? How do we make up for it? If we've had an issue with COVID, a personal experience with COVID, or something that's limited us, what can we do?
Yeah, I mean, well, it depends on in what way it's been limited, right? If you were doing an experience and it got cut short, right? What do? Sometimes they aren't restarting again, and so you're kind of left hanging, basically. In a situation like that, I would try to find an experience that's very similar to the one that you had before, where you can sort of apply the knowledge and skills that you gained from that prior experience to a new one, whether it's in person, whether it's virtually, basically. I think that's the main, that's really the main way, because, well, that's the main way you can do it. But what I would say actually is that I think everybody's experiences got cut short, basically. And so I think what I sort of went in detail about before, about the ways that you can find experiences and the fact that it would be virtual, is the way to go about it. Because there are a lot of virtual experiences out there. So there isn't a reason why you can't do it, unless you have bad internet connection, but that's something that needs to be rectified. So, you should be able to do that. The other thing I would add is, a lot of the applications that I've been seeing this year and even last year often have a prompt on there about how your candidacy has been impacted by the pandemic, basically, whether it's in terms of personal, academics, extracurriculars, or they might have a prompt where you can add something extra. Sometimes they say, is there anything else you wish to add, basically, right? And so that might be an appropriate place to write about something like that. But I would caution you, you have to remember that everybody's going through the same thing. And so sometimes you don't want to make it look like an excuse when actually there was a way to come around it and actually overcome it, basically. And, because sometimes I read these answers and I'm left thinking like, whoever's reading this is not going to have a good impression of this person, because maybe they didn't really put in as much effort as they should have in trying to find another opportunity. So I would just, of course, there are legitimate things, if, God forbid, maybe you lost a family member, or, impacted in that way, and you weren't able to continue because of that. Of course, anybody is going to understand why that was the case. But if it was because, oh, I was too busy with academics, or, I couldn't find anything, well, that's a little bit harder, the sniff test as well, basically.
Well, speaking about virtual experiences, there's a question here about, are medical schools wary of virtual opportunities, and how do they look at those opportunities?
No, I don't think they're wary of them at all, because quite frankly, between almost all of last year and throughout a lot of this year, virtual experiences has been the only way that you've been able to gain experience. No, I don't think they have a problem on that. I think it depends on the quality of the experience you're doing in and of itself, basically. But as a blanket statement, talking about virtual experience, I think that's actually sort of the new norm, basically, so to speak, until in-person experiences come back. And that's hard to say, because it really depends on the region of the country you're living in, and even in the city, even the hospital and the clinic, every single place has different rules, basically. And so until then, you have to sort of make do with the, quote unquote, second best option, which is sort of the new norm, basically, which is, virtual experience. Is it as, I think, sort of to skin that question in another way, is it as satisfying as doing it in person? I would say no. Yeah, I think it's more fun if you can be in the room with the patient, if you can actually be in the lab with the pipettes. Well, that's my worst nightmare. But for those of you like research, that's totally different, basically. But in terms of acceptability, no problem. No problem.
Okay, I think we have a few more minutes that we can do a couple more questions.
Sure.
The next one is, do medical schools apply different weights to clinical experiences in EMS? So EMT versus being a paramedic.
Wow, that's a great question. I mean, I would say probably most likely, there's not, because I often get this question of like, oh, do med schools put more weight on this versus that versus, whatever. It really depends on the medical school. I know this is the most unsatisfying answer to hear. I'm going to be brutally honest. I hate it when people say things like that. Now I'm going to say that to you. But it really does depend on the medical school itself. Yes, all of these experiences are important, but in terms of the weight and all that kind of stuff, it's really hard to say. And sometimes it even depends on who's reading your application, right? Everybody has a different experience. Everyone feels differently about certain kinds of experiences. I think it's hard to say like specifically the weight. I think, again, it goes back to talking in detail about the responsibilities and the results that you've gotten. I think, I think these are fair questions you're asking me, but I'm always wary about talking about weights and this versus that, because my approach is, in a way, I wouldn't even think about it. I would just optimize every part of your application. Because if you start thinking about this, is this worth more than this and that and all that kind of stuff, then, I think that actually ends up hurting your application more, basically. I'm of the mindset that you have to remember almost 60,000 people are applying every year, and there are phenomenal candidates who have excelled in every part of the field, every part of their candidacy, right? The difference among you as applicants, it's not like meters and feet, it's like millimeters, basically. This is why we harp on the importance of something that seems anal retentive, like make sure your essay is perfectly, edited in terms of punctuation, grammar, all of that kind of, it seems kind of crazy to harp on that, but that's the kind of difference. I'm not saying if you miss a period, you're going to get rejected, but if you have a lot of typos, for example, that's not going to leave a great impression for whoever's reading it, because they're like, well, if you're that careless with the most important application of your life, what does that mean for future behavior, right? Because the best predictor of future behavior is past behavior, basically. And so I think, I would optimize every aspect of your application, basically, is what I would say.
Yeah, it's interesting when you look at the statistics of how many students have extraordinarily high GPAs who do not end up getting accepted. It is just shocking.
It is.
We have another good question here about leadership. And I know you gave the one example of the student who was writing the training manual for volunteers, but this question is about, you talked about not having to necessarily have a leadership position to highlight leadership qualities. Can you give another example of how you might be able to show leadership qualities through a regular extracurricular activity?
Well, I think what I mean by that, like sort of an atypical way of doing it versus the regular president, vice president, right? Well, I think I'm going to kind of go back to what I said before. For example, let me think here. I had a client. I'm trying to use a real example, basically. Oh, I know what it was. So I had a client, I think, who was volunteering at the hospital, and I think it was in with pediatrics, and I think it was like doing artwork with children or something like that, basically. And we were having a discussion about, sort of her experience and what she was doing. And I think we sort of ended up having this discussion of, how she could show leadership, in this experience of, doing artwork with children, basically. And I think one of the ideas we came up with and talked about, and I have to be honest, I don't know what resulted from this, but I'm just going to tell you what we talked about, basically was, I think I had suggested to her that maybe she wanted to talk to her supervisor about how she could create an exhibit, a special exhibit with the artwork that children were doing that could, highlight it and create an event, I think that would, make it a very special moment for the kid, something like that, that would go beyond just, not that it's not important, painting with the kids, which is great because you can bond with the kids in a different way. But, at the end of the day, people like to feel special, right? And especially when you're feeling sick, you really want to feel special. You want to feel like you're, that you don't want to feel sick all the time, right? Like that's the problem with being sick. You're tired of feeling sick all the time. You want to feel like a normal kid, but you want to feel a little special. And so something like, maybe doing an event, an exhibit or something like that could have been a way where you make these kids feel special, to say like look at this amazing artwork that John Smith did, something like that. And so I think that's one of the ideas that we sort of bandied about. But again, I don't know what happened with it. But that's an example where you can take a traditional, a regular activity and put a twist on it and add some leadership initiative to it.
Okay, there was an interesting question that had popped up in the chat that where they were asking about paid work versus volunteer. Will med schools look at working during undergrad as a lack of commitment? I think, obviously that's a reality for a lot of students.
Yeah.
This is that they have to work. So
Yes.
How would you address that?
Yeah, no, absolutely. Well, the first thing I would say is, in terms of the volunteering as it relates to directly to community service, you have to do it, basically. That's almost a separate issue from working, basically. So no matter what, you really need to do the community service, help those in need, do it over a long period of time, show evolution and growth, get results, 100%. Now, as it relates to the working, no, I mean, no medical school is going to look down on whether you have to work or you want to work because you want to earn some extra money. My best friend in college was on financial aid and he had to work at the library every single week, many, many hours. And I think, quite frankly, if you're in that situation and you're juggling academics and working, that is so admirable, basically. I mean, a college is already hard enough without having to work. And then you layer that in and still able to thrive in academics. That's wonderful. And the other thing to keep in mind is, no matter what job you're doing, if you're getting paid, whether you have to do it or you want to do it or whatever, you have to remember that but you have to keep track of this. You are gaining unique knowledge, skills, and approaches to thinking from that, even if it's totally unrelated to medicine. That's wonderful, I think. That's good. That's going to be a great way to highlight yourself later on, as long as you can talk about the knowledge, how the knowledge, skills, approaches to thinking that you got are applicable to medical school later on and yourself as a future physician, basically. Just to use an example, it's not related to employment, but in terms of diverse thinking, I had a client who his major was theater, of all things, basically. And it was, he worked, behind the scenes, he acted, he did all of this, I know nothing about theater, but he did all this stuff that sounded fascinating to me, right? And we were trying to figure out a way how to tie that experience, integrate it into a personal statement. And he came up with this brilliant thesis. I think it was brilliant thesis about how he would be able to utilize his expertise and skills as a storyteller from theater to become a future physician later. And he just wrote a really great essay about all that. But I would have never thought about that. But he really came up with a good way to tie two disparate fields together, basically. And he ended up getting in at least one medical school, maybe more than one. So he was quite happy about that.
Well, I think that's a good segue into what I think probably is going to have to be our last question,
okay,
which is, how do you talk or write about your hobbies? You kind of gave an example there of the theater, tying in the theater into becoming a physician, but what are some other ways that you can kind of talk a little bit about your hobbies, what makes you unique? as part of you as the whole package?
Yeah. Well, I think to take a step back, excuse me, it depends where you are writing about your hobbies, right? So if you are writing about your hobbies in the work activity section, that is different than how you would write about it if you decide to write about it in the personal statement. If you're writing about it in the work activity section, it is a much more straightforward approach, basically. And the template that I give to all of my clients in terms of how to write their work activity section, is as follows. Number one, if you have an interesting reason for why you decided to get involved with the experience, share a little bit about that, because that always adds a little flavor. Number two, if you are part of an organization, even if it relates to your hobbies, that is not well known, if it's not like Red Cross, Habitat for Humanity, explain what it is. I can't tell you how many times someone writes about some organization I've never heard about, and you end up having to guess. The last thing you want to do is irritate the person who's reading that. So be sure to explain what it is. The meat of your description should be as follows. Detail the responsibilities that you have, right? Really go into detail. Don't just say like, I don't use vague verbs. I call them the vague verbs. Don't use verbs like, I did this or I observed that. Whenever I read that, I'm always like, what do you mean by I did? What specifically did you do? What specifically did you observe, right? So really detail, because you have to remember a lot of people are doing the same kind of activities. So you really need to differentiate yourself through the details. So responsibilities, and then results, as I mentioned before, talk about any results that you can quantify or qualify. And then, if there is a unique, significant skill, knowledge, or approach to thinking that you gain from that experience, you might want to detail that too. In terms of the personal statement, I can't go too much into this, but, when I tell my clients to write their personal statement, they are marketing themselves in terms of what makes them a unique candidate. So that means the way that I encourage my clients to write about whatever experience they're going to write about for their personal statement should be in a way that illustrates a quality about yourself. You have to tell a story that illustrates one of your best qualities, whether that's thinking outside of the box, perseverance, strategic thinking, because you're marketing yourself at the end of the day. So you're not writing about an experience just to write about an experience, basically. You don't want to sound like an IKEA manual, right? You want to be entertaining. You want to share something about yourself that is positive, that is going to be memorable to the person reading it. You have to remember, they're reading a gazillion essays. So the last thing you want to do is have their eyes glaze over, basically. So that's my short and dirty of how to sort of think about how to frame it.
Great. Well, I feel like we're just about out of time here, but I wanted to thank you, Dr. Yoediono, I hope I pronounced your name correctly. We do have a poll here asking when folks plan on applying to medical school, what time frame they're looking to apply, and what aspects of the application process would you want to learn more about in a similar session? And I guess there's a number of questions here. I was going to read through all of them here. How much did you learn? Would you be interested in strategic planning? And would you be interested in attending more sessions like this one? So you go ahead and respond to that poll. And I'd really like to thank MedSchoolCoach for working with us to put this on. This is great information. I think it's really helpful to folks, especially right now, with having to adjust and kind of course correct with COVID, on how you can do that and how you can try and really build a narrative for your whole application and how to approach things from that perspective. So Alexi, is there anything else that you have to add other than, I guess, go ahead and keep on answering that poll? And again, we'd like to thank MedSchoolCoach, and we'd also like to invite everyone who's attending to visit studentdoctor.net. Most people know Student Doctor for the forums. We have a lot of additional tools available, so you can use those to help you with your process and with your journey towards becoming a physician.